Guru Nation, listen, what I would do, I got a YouTube comment. What I would do if I had a master's degree right now and no clinical research experience, but I want to get in the industry. It sounds like cliche advice, like if you want to lose weight, you want to work out and eat healthy. It's literally the same thing. What you want to do is network. You have to have a LinkedIn. It's not optional at this point. You have to. You cannot be insular in trying to figure out how to get into this industry, especially if you have a master's degree. I think the master's degree is a double-edged sword because a lot of research sites, who I'm going to talk about right now, are going to think you're overqualified, so they're going to fear hiring you, but not as much as a PhD or a doctorate level, but still more so than a medical assistant or a CNA or a farm tech. And at the same time, you have a lot to offer to the industry as far as your education, as far as maybe your experience, transferable skills from other industries. So, or just maybe purely education. LinkedIn's the place for you. You have to get a LinkedIn. You have to network with people. You have to come to conferences like Save Our Sites, which is shameless plug, my own. Link underneath the video. It's the most affordable one by far, but there are others. You don't even have to go to the more expensive conferences like ACRP or SCRS. You can just find out what hotel they're doing it in and hang around the hotel, and you're going to meet researchers all day walking through the hotel lobby. Now, and you can pre-schedule your meetings through LinkedIn. So I would absolutely get on LinkedIn. Now, the question is, okay, well, what do I do now that I'm on LinkedIn? Do I just spam people? No. You want to follow other people with master's degrees. You want to follow research sites, and you want to see what they post, what they comment on, and engage in public dialogue with them around the topics that they are discussing. And yours can be, you don't need to fake it till you make it. Yours can be, hey, can you explain this a little more? I don't really understand. I'm new, but I want, based on my master's degree, this is what I've learned in school, but how does this apply in the real world? You'll be amazed how far those kind of conversations get you. It's the thirst of your ambition that people are going to smell. Now, I was sitting, you might want to try something like CRA Academy in your case. So, on one of my vlogs a few months ago, someone named Sonia, Dr. Sonia Sharma, she's actually a PhD, but it's same thing with masters. She finished my CRA Academy. She came to my internship program, and she actually visited Yuma for 2 days, and she shadowed us. She was one of the better students, so we had her come to my site, Yuma Clinical Trials. We went to lunch. She asked me this question: how do I find sites in my area? You Google. I literally Googled her zip code and clinical research site, and I found like 10 sites, 15 sites. Some of them were big institutions. We skipped them. But I found one in her area called San Jose Clinical Trials. I was like, okay, I never heard of them. This would be a good one. I found the person in charge of hiring. It took me like 3 minutes, by the way, on LinkedIn. The person didn't know me, so she didn't have any special advantage by it coming from me. I messaged her on LinkedIn, hey, one of my interns here, I'm very impressed. She lives in your area. She wants to be a coordinator. Here's her info. Fast forward 3 months later, I get notified from this student, hey, thank you so much for that. I got hired. That took by that clinic. That took me maybe 5 minutes total. You need to be doing this 24/7. You need to shoot your shots. You don't want to spam people though. You want to shoot your shots strategically. You want to figure out, okay, how do I approach this person? Where do I map out all the research sites in my area? Again, ignore the big ones. If you're going to apply to the big ones, apply to the big ones the traditional way on their website, or maybe through LinkedIn you can contact and find out, hey, can I get like an inside path to getting this job or at least internship? But the small sites are where I think your best opportunities are. And your issue might be that you're overqualified, but the sites are willing to take that risk if you come in with a knowledge for, at least theoretically, research and a passion for it. A lot of people come in, no knowledge about research whatsoever, and they're unsure if they're passionate about it because they don't know anything about it. Understandably, the sites are going to think to themselves, well, if I hire this person and they don't end up liking research, I just wasted time. So you want to get over that first barrier. Once you get over that first barrier, let me tell you, with a master's degree in research, you can do a lot. You can do psychometric rating scales, which is for central nervous system disorder studies. You can do a lot of things later in your career, like CRA, project manager, CTM, and beyond. But the key is getting your foot in the door. This is how you're going to go about doing it. Don't worry about any certifications, ACRP, SOCRA, none of those things. You can't even qualify for those things until you have 2 years of experience. If you're going to do something practical like my CRA Academy or my CRC Academy. Message me for more info. But this is what you do. This is It's nothing more complicated than brushing up on your knowledge of the industry. So if you don't have this book, get it. Networking, going to a few conferences, going to affordable ones, all right? And then approaching sites online, offline, and everything in between. And really don't ignore the networking part on LinkedIn. Engage with people's comments, engage with other people that are in careers you want, and start interacting with them. Like, subscribe, comment, share. Bye bye.